Well, today is Arts and Crafts Day here at Integrated Health of Indiana, and I've been asked, following on the heels of the neurodegenerative diseases, I've been asked to talk about Parkinson's. So first off, let's talk about Parkinson's. When they look at Parkinson's patients on autopsy, they can see in the brain stem the substantia nigra, which deals with the dopamine receptors of the brain. They start to deteriorate, so they get gone. And as they do that, we start to have symptoms. And so the symptoms of Parkinson's, so on here, on the diagnosis, we have Parkinson's. Symptoms of Parkinson's. We have tremors. There's all kinds of them. Let's look. So we got tremors. We got bradykinesia. Which means they get slow. They got stiffness. They got rigidity. We have anxiousness. We have depression. We have soft-spoken. The list goes on and on and on. When we start to really think about the cognitive issues and all of these, when we look at all these cognitive issues and the things that are happening to the person with Alzheimer's, those are the symptoms. And this is where medicine tends to treat. So medicine wants to treat all up here. But the question is, if you're treating the tremors and you're not treating the underlying problems causing the issues, so if we start to look at root causes, if we're not looking at the root causes, then these things happen and they continue to progress until there's a point of which there is no return. There are big problems for the patient. What we want to start to do is, with things like Parkinson's, Alzheimer's, and neurodegenerative diseases, with Parkinson's in particular, when we look at the substantia nigra, we want to make sure we don't allow that continue to happen, because there's only so much that we can give medication-wise that helps offset that loss of the dopamine receptors. So as we look at Parkinson's and neurodegenerative diseases, what causes these things? And more, we're starting to see that the microbiome, and this is why I am so into the microbiome. The microbiome plays a part. Of course, the gut and how the gut is functioning. We do have a genetic branch. So you can get tested. There are several SNPs that can be tested for. The LRRK2, the PRK7, the PINK1, the PRKN, and the SNCA. That's 10 to 15% of the population has these SNPs. But once again, SNPs only load the gun. They do not fire the bullet. So genetics, we have to have a trigger for the genetics. And what is the trigger for most of genetics is the environment. And when we look at the environmental triggers for this, you have toxins are a root cause, and that's linked to herbicides, that's linked to paraquat, that's linked to air pollution, dirty water, there's all kinds of toxins that can start to overwhelm the body. One thing that is a root cause that makes everything worse is age. People that are over 60 tend to everything starts to slow down. Your methylation slows down. Your digestive system slows down. You have all of these things that start to impact the body's ability to do what it needs to do, to detox, to give your body nutrition, to sleep, to do all of these things. And so when we start to look at the tremor, well, let's look at anxiety and depression. We can now see tons of information that says, hey, if your body doesn't have the bacteria that it needs, it can't produce the short chain fatty acids, which help with the hormones, which helps with the neurotransmitters, and we start to suffer from anxiety and depression. What's the number one cause that I see? I'm not saying that it's carte blanche for everybody, but what I see here, the number one cause of anxiety and depression is the standard American diet, which is high in sugar, causes problems with the hormones. It also is high in calories. It's calorically dense, but void of nutrition. And here's a hint. If you have a package that says enriched or fortified or whatever, that means they've taken everything that's good out of it and they've put a little bit back in so they can advertise. Whatever they advertise on the package is gaslighting because everything else has been taken out of it and it's generally a crap food. Real food does not come with the nutrition facts. So the standard American diet really trips the trigger on this, and it's also void of fiber. If you're dealing with a neurodegenerative disease, then let's just take the one who's done the most research on it. Let's look at Dr. Terry Walls. Dr. Terry Walls, who had MS, which is another neurodegenerative disease, kind of in the same autoimmune type of categories because the body is attacking itself. It's getting rid of things that we need to use. But MS, she said, hey, you need 40 grams of fiber per day. Guess what the typical American gets per day? Anybody want to take a guess? We're looking at about 8 to 12 grams tops. That's what the typical American is getting. So as we look at these root causes, these are the things that we need to take care of. And so another root cause is repetitive head trauma. Another root cause, if we want to look at this, I'm going to have to get down and start right and low. But another one is what we see with Parkinson's, ALS, meaning Alzheimer's, the proteins that make up your body, the amino acids make the proteins, but these things are three-dimensional structures. And they have these little tubules, and they're supposed to be in a frame that is identical. It's supposed to be a first generation, like photocopy is the best analogy I can start to think about it. But when you have problems with the microbiome, you have inflammation, you have infections, you have all of these things that cause drag on the system. It takes, best analogy, takes resources away from the ability of the body to make these perfect proteins, and they start to get misshapen. And as they get misshapen, the body can't use them. And so that's why we start to see like uh, amyloid plaques in the in Lewy body. It's alpha synuclein. These things start to misshape, misfold, and the body can't use them. So we have to have a really good microbiome, really good whole foods, really good fiber, so that we produce the short chain fatty acids, the amino acids, and the things that we need for the body to make these proteins correctly. And that way, these things don't happen and your brain is working appropriately. And those are the things that I look at that we can kind of control. So if you don't know what your microbiome looks at, it's time to take a look at it. It's time to say, hey, what's in this microbiome that needs to change? Is there an overgrowth? Is there an imbalance between the Bacteroides and the Firmicutes? Uh, is are the digestive system juices working the way they're supposed to work? Is the bowel inflamed? Is there blood in there? Because if the mechanism, if the machinery isn't working right, then you have a problem from the get-go, because you can't extract out of the food that you eat the nutrition that you need. And you got to make sure that that's working right. Is your pH off? Are you taking acid blockers? Acid blockers have been linked to all neurodegenerative diseases. And so what's happening? You got to start to look down here at the triggers and start to modify the ones that you can modify that help prevent this type of stuff from happening. Because there is no magic bullet. Even on the Alzheimer's drugs that have most recently been touted as being miracles, they found that they manipulated the data. So that's not good for me. I want these things to work because I'm an APOE 3/4. That's another thing, another root cause. If you are APOE 3/4/4/4, not that it is a direct link to Parkinson's, it does have a 20%, the 3/4 is a 20% late stage Alzheimer's increase. The 4/4 is even more than that. So I have a vested interest in that. But I also have a vested interest in Parkinson's because Parkinson's is on my father's side. We had two of my dad's siblings that had Parkinson's disease. And so I really want to watch these things. And this is why you hear me talking all the time. It's really hard to change your genetics. But when we're talking about genetics, what keeps those genetics from doing bad things? Are you getting good sulfur compounds in? Are you getting the things that you need, the methylation factors, cofactors, that don't allow that strand of DNA to open up so that it expresses itself? You can absolutely help that with real food. And you can also supplement yourself with methyl B and things of that nature so that doesn't, it's harder for that to express. The other thing is the studies they're starting to see on Alzheimer's and Parkinson's and neurodegenerative diseases, exercise is key. Once again, and I've said this in past episodes, we are predatory by nature. We are animals just like everything else. We like to think that we're different, but we're not. We're just a different species. We're still an animal. We are mammals, but our eyes are in front of our heads. That meant we're predators. So we are supposed to go kill our prey. Well, we don't have great nails. Our teeth really aren't anything to speak about. I mean, dogs' teeth look a lot more intimidating than our teeth. So what or how was the human being supposed to kill these other animals? And it's by wearing them down. We're actually supposed to be endurance athletes. We are supposed to wear something down till it can't fight back, and then we go bash it with a club, stab it with a spear, whatever we had back in the day. And so our being is about movement. Now, I'm not talking about going to the CrossFit gym every day and wearing yourself out. I'm talking about we're just meant to move. We're not meant to sit behind a desk 6 to 8 hours a day and do nothing but look at a screen. And so it causes problems in the way that our genetics express themselves. Plus, since we don't have movement, we don't maintain muscle. And since we don't maintain muscle, then we start to accumulate fat. And fat has its own pro-inflammatory markers, and it continues to self-sustain. So as we look at these things, these are the things that we can treat and control, even the toxins to an extent, because we can detox, we can use glutathione, we can use our diet, we can do these things to help us take care of ourselves and to keep the system going. Why don't we get it when we're younger? Our area under the curve, we haven't lived as long. If you've lived only a few weeks, area under the curve is very short. If you've lived decades, area under the curve is very long. And so things start to build up and break down. You have to support those systems, especially as you get older. And looking at these root causes, another thing is this happens in the brain. And the brain, we have to think about, give me just a second. Oh, let's clear up. My beautiful tree is gone, or is going. And no, I am not an artist. Sorry. So, if we really want to start to think about things, one of the things that they're starting to talk about, and going back to the exercise, is when we are looking at the brain itself. The brain is this big organ up in the head. It's actually not that big. It weighs anywhere from, your head weighs anywhere from 8 to 12 pounds, depending on how big you are, what size you are. The brain uses 25% of your glucose. And for something that's so small, right here, as compared to the rest of us, it uses a quarter of your glucose. They used to think that the brain and the gut were two separate entities, and we have this thing called leaky gut. And leaky gut, when that's leaky, it allows things to get into the bloodstream. Now we're back to how things perform. And there's supposed to be a blood-brain barrier that's impermeable. But we now have evidence that if the gut is leaky, the blood-brain barrier is leaky and it's allowing things in. So once again, we're back to the things that keep the body healthy. Butyrate, butyrate, helps seal these things off. This is found in real butter. But we also have bacteria in the gut that actually produce butyrate, and that's to help reseal the gut, to maintain the lining. The bacteria that maintain the lining of the gut are Akkermansia, Mucinophilia, Roseburia, and Phacobacterium. Nope, not going to try to spell that one. I'm bad enough at spelling as it is. Phacobacterium prodnitzii. Yeah, that's all you're getting. So these you have to have. If you don't know if you have those, guess what? You have a leaky gut, you got a leaky brain, and those are things that you can control. So if you can control those, you absolutely should. So in summary, Parkinson's is a loss of the substantia nigra in the brain. It seems to be triggered by inflammation and infection, and the body attacks itself so that the substantia nigra is disappearing. We don't know the exact cause. We do know that there are some genetic factors, there are some environmental factors, but then there are also a lot of factors that are in your control. And to prevent / reverse, because they do see people once they get on a very aggressive lifestyle plan, to include sleep, nutrition, exercise, stress, and community, we see symptoms reverse, hold steady, and give people lots and lots of good years. So it's up to you on how you want to take care of this. This is why I got into this space, because this one's about Parkinson's, but as I said before, I'm all about Alzheimer's. My grandmother and my mother both had Alzheimer's. Well, mom was showing signs of it. I shouldn't say she had it. She was showing signs of neurodegenerative disease and impairment, and that was her biggest fear. But in functional medicine, all of these root causes lead to the different diagnoses that give us the symptoms. And even I, at 30 and 40, was starting to have some problems with recall and being able to recognize patients and doing this, that, and the other. And I had no idea. And then mom died. And when mom died, it put me on a path of, okay, why? So as I started to research that stuff, then I found functional medicine. I had dabbled in it for a long time with my girls who had mitochondrial disease. Once again, another one of these things that has root causes, and you start to address the root cause, and then the mitochondrial disease, we were very blessed that they haven't been taken from us yet. So that's a good thing. Everything that we do is to maximize health span, lifespan. As long as on my last days I can sit there and play with my kids and do whatever, good. I'm down with dying at whatever age, as long as I could function all the way throughout. Does it mean I give up pizza weekly? Yeah, because I have SNPs that make me gluten sensitive. This is the thing. If you don't know your genetics, hit us up. We can help you figure that stuff out. Are you truly sensitive to gluten? Are you truly sensitive to, or do you have glyphosate in your bloodstream? Do you have whatever the case may be? Do you have heavy metals? Basically, we start with people very simply, and we look at the hormones, and we start to optimize hormones. We start to optimize the gut, and we look at the organic acids. This gives people a very good foundation of health, and it helps with taking care of all of this stuff. Then, if people want to worry about optimization and longevity, then we can start to tweak things to roll back the clock. So those things are up to you, but you have to have foundational health first, and that's all up to you. So I hope this helps. And with that being said, we'll see you next time. If you have any questions, hit me up in the comments, send me an email, dr.miller@integratedhealthofIndiana.com, and I would love to help educate you. This is not treatment advice. We don't have a doctor-patient relationship. So with that being said, I'll let the disclaimer say it all again. Have a great day.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.